Welcome to the Aced It podcast, where we turn science into sense. In this very special season funded by the Bureau of Justice Assistance, we provide 10 timely episodes with the hopes of helping listeners understand what we can learn from current research that will help correctional staff. And please note, we did not just guess at what correctional staff need to know. We traveled the country, interviewing individuals working in prisons and jails, and the topics of these episodes are exactly what they asked for. So, I'm Danielle Rudes, your host, and here we go. In this episode, we tackle two focal areas that correctional staff from our study perceive as critical for their work. But these are also two areas staff strongly feel they do not have the best training on. These are post-traumatic stress disorder, or PTSD, and suicidal ideation. In so many of our interviews, prison and jail staff all around the U.S. expressed a need for up-to-date and easy-to-understand information about PTSD and preventing suicide attempts. Many of these staff expressed that they wanted training to help them develop better ability to assist residents who are experiencing one or both of these challenges. The need for up-to-date and easily understandable information is incredibly important, as it could potentially be life-saving. And not just for residents, but for staff too. So, in this episode, we focus on current science that comes from two research studies. The first is by Facer-Irwin, and it dives into PTSD in prison settings. And the second study, by Nguyen and colleagues, highlights what we know about the formation of and persistence of suicidal thoughts. Intriguing, right? I know, I agree. We hope this information will help expand correctional staff knowledge around mental health in prison. So, here's the science. First, in 2019, in a systematic review titled PTSD in Prison Settings, a Systematic Review and Meta-Analysis of Comorbid Mental Disorders and Problematic Behaviors, Facer-Irwin and colleagues discuss what PTSD and other mental disorders and/or problem behaviors look like in a prison setting. They report that PTSD rates are higher among individuals in prison than among individuals in the community. They note that prior studies identified a disproportionately high number of incarcerated individuals who have been subjected to a lifetime of exposure to trauma, with many also having mental health disorders. Both exposure to trauma and mental health challenges are linked to both suicidal and aggressive behaviors. This is a bad combination for prisons and jails, and yet it is all too common among incarcerated people. Using what is called a meta-analysis, Facer-Irwin and colleagues examined 36 previously published studies to determine, based on all of these studies combined, if and how PTSD is associated with other mental health disorders and suicidal or aggressive behaviors in prison. Their study included 9,594 individuals, both male and female, and both young and adults, from over 11 countries, including the United States and the United Kingdom. The review revealed a significant association between PTSD and comorbid mental disorders. These disorders include depression, which was the strongest, anxiety, and substance use. They also found that PTSD and comorbid mental disorders had significant links to suicidal ideation and aggression. From the adult samples that were taken from 5,455 participants, there was a significant association between PTSD and suicidal ideation among incarcerated males. However, there was no association between PTSD and instrumental violence, meaning that those who suffer from PTSD are less likely to engage in violence unless there is some type of perceived threat and/or concern for their safety, rather than just from callousness or lack of empathy. The high prevalence of psychiatric comorbidities among residents with PTSD confirms the need for thoughtful and informed approaches in prison. We will go into more details as to what these approaches look like and if prisons are actually capable of being trauma-informed in a later episode in this season. Facer-Irwin and colleagues offer that PTSD is often not part of prison screening processes, but perhaps it should be. The presence of PTSD among individuals in prison is often unknown, and yet their meta-analysis suggests significant association between PTSD and poor treatment outcomes, including treatment adherence. Not something any prison wants. When they offer treatment, it is to generate positive outcomes, but this may be harder with individuals possessing PTSD, especially when that PTSD is undiagnosed. In addition, Facer-Irwin and colleagues emphasize the need for a larger longitudinal study that can further help explore the long-term impact of PTSD in incarcerated individuals. Now, along with concerns about PTSD, correctional staff frequently report a need for additional training regarding trying to detect and understand suicidal ideation. They are concerned that some residents may experience thoughts about suicide, and it is often difficult to see it and determine if and when it requires action on the part of staff. Actually, if I'm being honest here, some staff have actually lost fellow staff members and didn't know that the person may have been having suicidal thoughts. So this would be relevant here too. A recent study by Nguyen and colleagues in 2021 looks deeply into suicide causation for 4 main factors. 1, suicidal ideation. 2, help-seeking willingness. 3, a sense of connectedness. And 4, information inaccessibility. Using data collected from Japanese college students, Nguyen and colleagues' article finds 3 fundamental conditions for preventing suicidal thoughts. Ready? Okay. 1, a high degree of belongingness. 2, accessibility to help-related information. And 3, healthy, perceived cultural responses toward mental health. That was a quote. They note, here's another quote, systematically coordinated programs are necessary to effectively tackle suicidal ideation, unquote. Now that's a lot to take in, so let me recap. To have success in preventing suicidal thoughts, individuals must feel they belong, they must be able to find or get helpful information, and they must think it is okay to ask for help and help will come. Does that sound like a prison and jail environment to you? In most cases, sadly, it does not. So yes, this study is examining the suicidal thoughts of Japanese college students, but we're talking about prisons and jails. I know, but I promise what they found is relevant. Stay with me. These Japanese students are excellent population to study when thinking about suicide, as suicide rates in Japan are among the world's highest, especially among individuals between the ages of 15 and 39 and university students. So, while not exactly the same population, what we learn from their experiences and their thinking is hugely important for our carceral context. To get the answers they were interested in, Nguyen and colleagues examined suicidal thoughts using a multi-filtering mechanism referred to as mind sponge. I know, interesting name, right? Mind sponge. The mind sponge mechanism, the researchers argue, is superior to other models that have shown inconsistencies in results because it allows a kind of slow absorption of data, like a sponge, that better untangles an excessively complex mental process. The mind sponge mechanism allows researchers to look at data in interesting ways. They note, quote, every person develops a mindset, or a core set of values, that defines the person's identity, perceptions, and behaviors. The mind sponge is a mechanism illustrating how a person can absorb new values and eject waning values conditionally based on context. The absorbing and ejecting mechanisms are driven by a multi-filtering information process, detecting and connecting insights, or information, among different disciplines, as well as using inductive attitudes for plausible reasoning. For clarity's sake, Mind Sponge is not only a coping mechanism aiming to solve internal conflicts, but rather a broader, more inclusive model of cognition shifting processes, which includes such kind of adaptation, unquote. Basically, when a person gets information from their environment, they decide if or what they'll do with that information, keep it or disregard it, etc. And that decision is based on the value of the information to them. People filter this information based on a kind of cost-benefit analysis that is both rational and emotional, but it is also very layered and complex. Some information is kept and becomes part of future decisions, while others is simply discarded. So, Nguyen and colleagues' work wanted to specifically understand how suicidal thoughts are formed and how people can get rid of those thoughts once formed. Let me cover the key findings around a few areas. So first, connectedness. When people feel connected, they are more likely to seek help and less likely to have thoughts of suicide. Feelings of isolation and loneliness are tied to feeling disconnected. However, feeling connected does not necessarily mean it is sufficient to prevent thoughts of suicide, but feeling connectedness is a necessary factor to prevent suicidal ideation. Next, information. Feeling connectedness is not a fundamental predictor of suicidal ideation, but rather a psychological trait affecting the processes of filtering suicide-related and help-related information. For example, if an individual feels connected but tries to connect to the wrong social groups, it can lead to suicidal ideation. And an individual who does not have access to help-related information may be attracted to, quote, depressive peers or suicidal-oriented media for temporary emotional sympathy or for other personal reasons. This may be deadly, unquote. Responses. Feeling like a person has somewhere to go for help and seeking that help that is not stigmatized is another possible suicidal ideation preventing factor. If there are negative perceptions about mental illness present in the person's culture, the perceived cost of help-seeking may prevent that help-seeking, and suicidal thoughts may become persistent. The authors contend that we need a, quote, more systematic and dynamic approach to studying mental health problems and psychiatric issues, like what we get from MindSponge. Suicidal ideation will not be, quote-unquote, fixed with a single approach, but rather we need a set of systematically coordinated programs that will improve individuals' sense of belongingness, increase their opportunities to seek help via information, and improve cultural responses so help-seeking is not shunned and they do not feel shame for doing so. That is a lot, but it is all critical, and I'd argue not currently how things are handled in U.S. prisons and jails. So, in this episode, we focused on two important articles, each containing scientific findings that could potentially help correctional staff learn more about mental health challenges among prison or jail residents. First, the systematic review by Facer-Irwin and colleagues examined the prevalence of PTSD and comorbid mental disorders among incarcerated people. Their findings highlight the significant association between PTSD and conditions like depression, and how these mental health challenges may contribute to behavioral issues like aggression and suicide. We also discussed the thought-provoking study by Nguyen and colleagues, which examined the complex factors contributing to suicidal thoughts. Their research suggests that a higher sense of connectedness is associated with lower suicidal ideation and a greater inclination to seek help from others, but seeking that help must be culturally supported. While studies we discussed focused on two different populations, such as incarcerated individuals and Japanese university students, the lessons we can draw from them are relevant to mental health support across various populations. By understanding the nuances of two prominent carceral mental health challenges, PTSD and suicidal ideation, we can work toward fostering healthier and more supportive environments. For more information on mental health in carceral settings, please also consider listening to the next episode of this season, episode 4, which provides an overview of ways prisons and jails might think about addressing trauma in carceral settings. For now, though, take care of yourself and take care of each other. No one should suffer alone. Thank you for listening to the ACEDIT podcast. We love hearing from you. So if you have comments, topics to suggest, or some research you'd like us to cover in a future season, please write to me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And now, a whole bunch of thank yous. First, this project was supported by a grant 5PBJA22AG00031MUMU, awarded by the Bureau of Justice Assistance. The Bureau of Justice Assistance is a component of the Office of Justice Programs, which also includes the Bureau of Justice Statistics, the National Institute of Justice, the Office of Juvenile Justice and Delinquency Prevention, the Office for Victims of Crime, and the Office of Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking. Points of view or opinions in this podcast are those of the host and the research team, and do not necessarily represent the official position or policies of the U.S. Department of Justice. Then, more thank yous. Thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriter, SHSU master student Jalen Magana, and to my amazing research team at both Sam Houston State University and George Mason University. The team includes Bryce Kuchmarek-McCune, Sydney Engel, Caitlin Bauer, Shalom Aganaya, Alexa Mata, Chelsea Narvi, Alyssa Toman, Miltonette Craig, and Wyatt Brown. And a huge and heartfelt thank you to Jason Luton and the team at Slonky LLC for their fabulous podcast production. Tune in again soon for another episode of Aced It.